St. Mary's Hospital Medical Center, set in the heart of Wisconsin's capital city. Our 900 nurses and nursing staff care for patients in a variety of hospital settings, focusing special efforts in cardiovascular services, obstetrics, emergency services, minimally invasive surgery, and neurosciences, including 5 intensive care units. We're anxious for you to hear about how shared governance shapes our practice and what it's like to be part of our nursing organization.
Shared governance is nursing taking accountability for what nursing does. They have to take a leadership role now. We're no longer waiting for someone to tell us how leadership should be done at St. Mary's, because nursing is in that role.
In typical hierarchical management structures, the buck stops here is a very real kind of notion. Managers have the ultimate decision-making in all areas, and while they may get input from the non-management staff, really the decision-making for all things rests with the managers. In our model, we have shared accountability, which means the clinicians are primarily responsible for defining their practice, improving the quality of that practice, and assuring that everyone who is practicing is competent.
Shared governance to me means that management is accountable for making management decisions, and clinical staff is they're accountable for making the clinical staff decisions, whether that's defining our practice or whether that's measuring our quality of the care that we give, or measuring the quality of each other, or staff education, or whether it's doing research or using research that's already been done, all of which is to improve patient outcomes.
We have councils that would be accountable for different parts of what we do. Management would be responsible for the resources. Education would be responsible for the competencies. Practice is responsible for the practice of our nursing. And research is how we get our work done, if it's research-based or why we do what we do.
What I like the most about shared governance is that it includes all of the staff. It's not one person saying, this is what you're going to do. Everybody gets to get their input, so you get all these ideas, and not just one person's.
It's always a challenging job to be a unit secretary, but shared governance has made it easier by making me feel like I'm a part of a nursing unit.
I guess being on shared governance, you get the opportunity to be on other councils, and you get to be just a part of the hospital house-wide, and you share more than just being a nursing assistant. You have a role in helping other people.
We can impact on what the protocols are and how we do things. And we use a lot of the evidence out there in the nursing literature and everything to help us make these decisions.
I believe it's affected the patients by giving them better quality of care. With the nurses being involved, like I've said, on the front line with care and decision-making processes involving policies, procedures, directives of care, practices of care, that the patients are our top priority. And anything that we try to make decisions upon, we keep them at the front line, including their families, so that we're able to make the decisions to best affect their care.
You used to come in and work your 8-hour shift and go home. Used to blame other people for the way things were. Now I have the accountability. I have to improve the way things work around here. If I can't do it, I know where my avenues are. The way things work around here is my accountability. The patient care isn't going to improve unless I work on it.
At first, it's kind of a scary concept because you have this added responsibility and this added accountability. But once they see the benefits of no one's going to tell me how to practice at the bedside, I can make that decision, I think that's a real positive aspect of it.
That's part of the shared responsibility with shared governance, is we're all responsible for our own practice. And nurses don't necessarily take each other to task over things, but they would feel comfortable doing so, that if there were something not being done, that it's your responsibility to get it done, and if another nurse sees that it's not being done, it's their responsibility to make sure that corrective action is taken. So it's not dictated on from above. It's kind of everybody helping each other out and everybody trying to make everybody else better nurses.
The nurses that practice here at St. Mary's view being accountable for their practice as just one of the inherent rights and obligations that came with their licensure. So those who work here and practice here and love to be here wouldn't have it any other way and take great joy in the way it allows them to use their talent and their education. The other side of that coin is this model is not for everyone. A nurse who is more interested in more of an assembly line approach where they would want to do a good job but want to be directed in terms of what to do, this would not be a good fit, and it is not for everyone.
I think I've grown because I know that St. Mary's is a great place to work, and I want to stay here. So it challenges me to really continue my education, to continue to grow, to not just rest on my laurels, so to speak, but to stay really abreast of what's going on.
You just don't realize all the leadership capabilities that you have. I mean, if I had ever looked, years ago, if I had known how far, and how much of a leadership position I would have, I would be very surprised. But that's the nice thing about shared governance in general, and St. Mary's, is that they really foster, they really encourage that growth, and they expect that growth.
I can just think of an example. I know a nurse that I work with. She was someone who just sort of fought the process. Didn't really seem to be someone who wanted to get involved much, and once she got on a committee, she became this very highly organized, good communicating person that just, she had professional pieces in her that I never knew existed until she became a part of shared governance and had the opportunity to let those things show.
Through shared governance, when I first started on the house-wide level, it opened up my eyes to the rest of the organization. Birth Suites being a very specialized unit, we were pretty much focusing on ourselves, but by being on the house-wide councils, I got a broader view of some of the issues that are going on house-wide on different units, and it helped me to understand better how to support the rest of the organization, such as with floating or mobiling help, utilization of supplies, things like that. They made a big difference.
My favorite part of shared governance is that staff becomes privy to information that in other places it doesn't happen. I mean, when we have a question, we ask it and we get answers. It's not like things are secretive like they are at many different places that I've worked at. People are very upfront. People let you know what the bottom line is, so to speak.
I share with the nurses the hospital financial situation. I translate the income statements into everyday language, and that is shared. We talk about the financial situation of SSM Healthcare, which is our healthcare system. We talk about the competitive environment locally, what's going on. We talk about legislative initiatives like the Balanced Budget Act that will have a great impact on us, so that the nurses can have the broadest possible picture, the biggest picture mentality possible, so that they can understand that only through adaptation will we continue to thrive and be successful.
Those of us who are on the units working with the patients are the ones that are at the table with the doctors, with the administrators, deciding how care is going to be done. It is unique because I've never seen an environment where that's done before. Usually the decisions are made and we then carry out those decisions. Now we're helping make those decisions.
I think being involved on different teams and meeting different team members, it's not just you by yourself. You get to meet a lot of different nurses on different floors knowing what they're going through, which I think is important. It's not just me, I anymore. It's how are we going to get together as a team.
I feel like administration and everybody from the VP to the housekeeper and the dishwashers we're all sort of in this together. And it shows in all the things that happen around here.
It's like a collaboration of all of the units together to say, how can we help each other? How can we give the best patient care to our patients, and how can we be good to the family members, good customer service?
I think it's a unique environment in that we will give you good orientation on how to do your job, but we will expect you to start being part of the decision making. You will become involved. It just occurs. I don't even think people are aware of it, that you become involved in changing the way care is done around here.
What I like best are changes. And I like it because I've had input into those changes. And I think if you ask anyone else here, that's what they would say too.
Shared governance has made it challenging and a little more fun. It allows us to see the whole picture on how things operate and how we take care of patients. The fun is because we can choose how we want to do it.
What I like about working at St. Mary's is my first time walking in the door, I felt that there was a friendliness, and I just felt like you could feel the people would say hi to you. They were friendly, they were personable. I felt like it was a positive environment, and that's what I was interested in, was working in a positive environment.
It gets stressful, of course, any place does, but even in the stressful times, I feel like there's just sort of a little camaraderie that I've not felt other places that I've worked.
It's an exciting place. It's not an easy environment. Acute care, patient care is a very difficult place to be today. The patients are very sick. The stay is very short. The things that need to be accomplished are many and great in magnitude. So it's a difficult role. It's not where everyone wants to be. But we have a really positive attitude about what collectively we can accomplish together, and you can feel that. You can feel something really different in this hospital.
When you work here, you will be given the opportunities to do whatever you want to do. You'll be able to grow, you'll be able to learn, you'll be able to advance. But one thing you won't be able to do is just do your job. And if you want to come to work and just put your hat on and walk to work and leave, this probably won't be the right place. But if you want to learn, grow, advance, and become really stimulated, this is the best place.